Good afternoon. I will present part of the results of this project, Environmental and Population Health Impact Assessment in Tuscany. We know that air pollution has negative effect on population health, including an increase in mortality from all natural causes and exacerbation of pre-existent health conditions and so on. It's known that air pollution can have long-term effects or short-term effects. Long-term effects are the effects that appear years after chronic exposure, repeated exposure to air pollution, while short-term effects are the effects that manifest after a few days from a peak of exposure, for example. It's well known in the literature that long-term effects are stronger than short-term effects. However, investigating the short-term effects is very important because it's useful to quantify the immediate burden of disease caused by the current level of exposure, and additionally can help in designing public health intervention that can have immediate effect on population health. Oh, sorry. In this part of the project, we use daily data regarding mortality in 8 municipalities in the surrounding of Florence for the study period 2008-2019, and also the daily level of exposure of the main air pollutants that are present in the urban areas, in particular particles, PM10 and PM2.5. And we obtained these results. On average, during the study period, we found that the number of deaths increases by 1.46%. This is the short-term effect of air pollution for each 10 microgram per cubic meter increase in PM10, and very similar results also for PM2.5. But, so there is an effect of these two air pollutants on mortality. But the question is this effect constant over time, or this effect changed during the study period? We found that this effect changed over the study period. In particular, we can see that the effect, which is represented here for the two air pollutants, PM10 and PM2.5, is lower during the first year in the study period, and then increases with a peak around 2015, and then there is a slight decrease in the effect on both the air pollutants. So this is not recurring about the safety of the air that we are breathing now, because there is an effect which is higher in the recent years, even if the level of the air pollutants, which is represented here by these segments, decreased over time. So there is a decrease of the air pollutant level, but at the same time the effect increased. So which is the reason of this behavior, of this time behavior? A partial explanation of this behavior can be this one. Maybe the dose-response function that is represented here for the two air pollutants can be not linear. So the dose response function has this shape. So the effect here is represented by the slope of the function of the curve. So when the curve is steeper, the effect is higher. So this means that when the level of air pollution is lower, like in the recent year, the effect is higher. The curve is steeper. This can be a partial explanation, but is at the same time confused with other possible reasons for the behavior that we observe over time. So these are our conclusions. First of all, our finding stress the fact that the impact of air pollution on mortality is dynamic, and it changes over time, and probably and partially is influenced by a nonlinear dose-response function. But at the same time, we cannot exclude the role of other factors. For example, changes in pollutant composition, in particles composition over time, or interaction with temperature. When the temperature is higher, for example, during the 2015 temperature was very high during summer, this could a reason for this interaction between air pollution and temperature can explain the higher effect in some year during the study period. But a general message is that moderate and low exposure are not safe. So, and also it's important to stress that in this small analysis, we considered mortality, which is only the tip of the iceberg, because air pollution can affect health in many different ways, not only with mortality, which is at the top of the effect. And so the message is that we need to reduce emissions as much as possible and as soon as possible. See, so this is the final message of our results up to now. Thank you.